Hi, I'm Dr. Elizabeth Matsui. I'm a professor of population health and pediatrics at Dell Medical School. I am going to bust some mask wearing myths in this video. So the first myth is that I was told that I didn't have to wear it a couple of months ago, so why do I need to wear a mask now? I must not need to wear a mask now. Well, the reason the recommendations have changed is because of science. And so you're actually witnessing science in action with the changing of the recommendation. And because of science, we've learned two things about the virus since the original recommendations about mask wearing that have changed the recommendations. The first that we've learned is that people who are asymptomatic can spread the virus and in fact appear to be responsible for a lot of the spread of the virus. The second thing that we've learned is that just breathing and then talking, shouting, and singing actually emit virus into the air, and that the infection can be spread that way. And so if you put one and two together, you have a picture where there are many people out and about in a community. Some of them are infectious and don't realize it. And even through breathing or talking, they may be spreading the virus to others through the air. Okay, myth number 2 is that wearing a mask doesn't really help me at all. I get that it helps others, but it doesn't help me at all. That's a myth. It actually does help you. It helps you a little bit less than it will help other people around you if you are infectious, but it does help you some. And so you're also helping yourself by wearing a mask. The other way that it helps you is that if you wear a mask, it sends a message to people around you to also wear a mask, and that it is the appropriate thing to do. And the more people in our community who are wearing masks, the lower the infection rate will be in our community. Myth number 3 is I don't have to practice physical distancing if I'm wearing a mask. That's false. You do still need to practice physical distancing if you're wearing a mask. So physical distancing helps protect you and other people from droplets that you may produce if you're infected, or another person may produce if they're infected that has virus in it. And the further away you are from the person, the less likely you are to be exposed to a large amount of virus. Masking, while it does provide some protection to you, it doesn't provide enough protection in order for you to be safe if you come into closer proximity to somebody. And so mask wearing does not replace physical distancing. The last comment I want to make is that mask wearing is a part of many actions that you can take to protect yourself, protect your family and loved ones, and also help reduce the level of virus in the community overall. And so this includes things like good hand washing and hand hygiene. If you are having any symptoms, isolating yourself and reaching out to get tested. Last, there are proper ways to wear a mask and to put a mask on, take a mask off, and wash it. And you can find out more about that information from the CDC website.